Good afternoon, and welcome to our very, very famous testing site here, our COVID testing site, which is transitioning today to a vaccination site. So thank you so much for joining us. And really, I thank the media for coming down today in helping get the word out. It is so, so very important, now more than ever, that everyone be vaccinated. And as you know, it looked like we were making a tremendous amount of progress, and we have. There's another strain that has come out, and you're going to be hearing more about that. So it's ever so more important to get people vaccinated. And I think right now we are addressing the hardcore. People are like, I don't know. I talked to someone this morning and it was, I'm not sure which one. And like, just get it done already. Back on November 18th, actually, while we were in the height of the pandemic, that second surge of the COVID-19 pandemic, the town partnered with Good Samaritan Hospital, and they were ever ready. Just threw the idea out, and they were there to partner with us to help make this happen within a matter of days. It is a free testing site. It's been a free site all along, and obviously with the vaccinations, they are free also. Since then, we have conducted more than 2,000 tests. The site is the only drive-through site on the South Shore of Suffolk County. And that's important to people. They don't necessarily want to have to go into a building. They're still uncomfortable, especially if they haven't been vaccinated. So to be able to just drive up here is very, very appealing. It's through our long-standing partnership with Good Samaritan that we were able to provide our residents with the tools and information they need to stay safe and healthy and help stop the spread. And that information is very important because in addition to providing the testing, now providing the vaccinations, there was a tremendous amount of education that took place here. And it's a great place right in the center of the Brentwood community, which has been a hotbed of COVID positive cases in the county and quite frankly on Long Island. As other communities, other hamlets have seen a downtrend down to 0 cases, we've seen the numbers go down in Brentwood, but never to 0. And it just seems like we're getting there, and then up it goes again. In fact, today it ticked up a little bit. So it is important that we keep out there. And the Community Development Agency, in providing that funding for us, Julie, I can't thank you enough. That's what those funds are for, coming from the federal government. But to be able to take them and target them and really have them have a positive outcome is so very important. And again, I can't say it enough. We could not have done it without Good Samaritan Hospital. Again, didn't hesitate. The minute we threw the idea, within 3 days, this tent was up and running. And again, thank you, Tom, for, we had the tent. Obviously, it's ours with that big fat seal on the top. But for Tom and his team, Deirdre, everybody who was a part of it, thank you so much. And certainly one of the big players, Good Samaritan Hospital. And with that, I would like to ask Ruth Hennessy if she would come up and say a few words. Ruth?
Thank you. Thank you, Supervisor Carpenter. I wanted to take this opportunity to thank Supervisor Carpenter and the Town of Islip for affording us this incredible opportunity to continue to service one of our primary service areas for Good Sam. Early on, I think we went from a high rate of about 15% to now 2% or under on the testing site. So that shows great work and great collaboration and great education, as Supervisor Carpenter mentioned, with the community. But some of those things we need to carry forward. Some of those things that we learned that effectively hold back on the positivity rate are things like washing your hands and on not going to work and not going out if you don't feel well. And I personally, and I know Dr. Rayo will have an opinion on this as well, as we enter what is traditionally our flu season, to make sure that we keep up those efforts so that we don't have another problem on that side as well. So I'm very cautiously optimistic about this. We're thrilled to be able to do vaccinations here, and I'm ever so grateful not only to the Town of Islip, but also to the staff at Good Samaritan Hospital and all of the essential workers that helped get us through this horrible past year and a half. Thank you.
Thank you very much, Ruth. So anyway, this is my resident pal, Dr. Chris Rayo, who throughout the entire pandemic, we did a series of radio/TV interviews that really got information out into the public, and it is so, so very important. So with that, with the talk about the strains and the effectiveness of the vaccines, we thought it's so important to have Chris come down here and share some of that important information with us. So, Dr. Chris Rayo.
Thank you, Angie. So first off, I wish I was still young enough to be a medical resident, but unfortunately that ended back in 2003. It's great to be out here, outside, not wearing masks, but I think it's important that we all remember that it's really been a fight. So there have been over 34 million cases of COVID across the United States, a little over 600,000 deaths, and here in Suffolk County, a little over 200,000 cases the last time that I checked the numbers. But we're in a great place right now. So the 7-day average of new cases in Suffolk County is approximately 25 cases per day. As recently as January, that number was approaching 2,000 cases a day. But as we've seen with COVID and as we've seen with other viruses over time, these things come in waves. So we appear to be on the downtrend, but we still need to do everything possible to prevent another surge. But there is more good news. Medical teams today are much better prepared. There are therapies such as monoclonal antibody infusions that we're now utilizing that have been extremely effective at preventing hospitalizations and ultimately preventing deaths. Incidentally, last week at Good Sam, we did not have to use that therapy at all, which again shows you that we're in a really, really good spot right now, but we need to keep that going. The primary reason why we're in this position is the success of vaccination programs across the state. So globally, approximately 24% of people have had at least one dose of vaccine, and here in New York State, approximately 55% of New Yorkers are currently fully vaccinated. This is even more important now with new variants, new strains, as Angie referred to. So, right now the Delta strain, which originated in India, is now spread across more than 85 countries, and actually in the United States, it's the most common variant. That's a little scary. However, it's also important to note that the mortality and death rate, if you're vaccinated, is exceedingly low, likely less than 0.01%. And those numbers are taken, again, globally, particularly in Great Britain. They have some good data. 99% of the deaths in June in this country were in unvaccinated people. So vaccination, 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 and it's even more important in underserved communities. So those communities that have difficulty accessing medical care, those communities tend to have higher vaccine hesitancy. So people who are skeptical about getting vaccinated, those areas are areas that we really, really need to focus on and really need to target to get people vaccinated. And I'll end with just one last little story. So yesterday I was talking to 4 or 5 of my physician colleagues, and I told them I'm going out tomorrow to speak to the community about COVID. Give me some of your guys' thoughts. You guys work and see these things every day. What's the one message? And almost uniformly, all in unison, they all said everybody needs to get vaccinated. So I know there's some hesitancy out there, but we really need to push everyone, our family, our loved ones, our friends. Everybody needs to come out and get vaccinated. And I think this site is a great opportunity for those who are having difficulty accessing that care to come here and get their vaccine. Thank you.
Thank you so much, Chris. And I didn't mean to say that you were a resident. When I said resident, I meant in this, not the medical sense, but the sense my own personal expert that I could call, at a moment's notice, who made himself available. Did you say 200,000 cases island-wide or county?
County.
All right, so of those 200,000 cases in Suffolk County, nearly 12,000 positive cases were attributed to the hamlet of Brentwood. 12,000. out of the 200,000. That's really huge. So that's why this site here today is so important to this community. And we're counting on all of you to help us get the word out. As Chris said, vaccinate, vaccinate, vaccinate. And, you know, I don't want to hear this, well, I'm not sure which one I'm going to get. Whichever one is available, whichever one you can get to, whichever one you can get first is the one you should get. Because regardless, from what I've been told, and you'll correct me if I'm wrong, but regardless of which vaccination you get, they are going to give you protection against a severe case of COVID, landing in the hospital with COVID, or worse yet, dying from COVID. So get your vaccination. So with that, you need to just register, and it's just a simple phone call to get your free vaccine, and it's 631-376-3224. 631-376-3224. There are flyers. If anybody out there can go to the town website, islipny.gov. We will get information out to you to help us get everyone vaccinated. Does anyone have any questions? Is there anything anybody else wants to add? No? Okay, well then I guess it's a wrap. And again, thank you so much for listening. Thank you so much for helping us get the information out to vaccinate. Thank you.